There's two people we're seen following to their deaths. It's unclear if the man in the video survived or how the video got out if he did not survive. Obviously, it's pretty difficult to try to figure things out with that. All right, now back, not to Afghanistan, but to COVID. The growing list of everyday activities requiring proof of a COVID vaccination continues to grow. The NYC vaccine mandate goes into effect today, adding San Francisco and New Orleans to the list of cities that require vaccinations for indoor activities. Now, two NFL teams want to see your CDC card before going to a home game, and there is evidence that the arm twisting is working. Vaccine rates are growing. And now the CDC recommends booster shots for everyone 8 months after their second shot. So if you want to continue to participate in all these activities, get ready to roll up your sleeve again. What's also growing, though, is the backlash to vaccine passports, led by nurses and doctors across the country who are now suing their employers for requiring the shot. Jennifer Bridges is a nurse in Houston. Houston Methodist Hospital fired her, along with 100+ other staff members, for refusing the vaccine. Jennifer, we appreciate you joining us. I think we can all agree, and you've seen this firsthand, that COVID is deadly. Why are you more scared of the vaccine than you are of COVID?
I'll be honest. Well, thank you for having me.
Thank you.
I had COVID last year, and I had a very mild case.
Okay.
So my natural immunity is already proven to be good, so I don't actually require the shot. In every good study and research you see, it's actually contraindicated. And with my own eyes and with so many people reaching out to me, I have seen so many horrible adverse reactions, from anything to paralysis to blood clots, miscarriages, even death. Like, I don't want to take those risks. Nobody knows how this is going to affect their system and any long-term reactions until they take it, and then it could be too late.
You bring up an interesting point that the FDA has not fully approved it. It's still in emergency approval mode. That might change, at least with the Pfizer shot coming up. If the FDA fully approved the vaccine, would that change your mind?
Absolutely not.
Okay.
I think if they approve it anytime soon, that's too quickly. We haven't had the proper research yet.
And just to be clear, are you anti-vaccine across the board, or for your kids or for yourself? Because flu vaccines for healthcare workers is pretty common, right?
Oh, yeah. I took the flu vaccine in the past, all the other vaccines, so did my son. Oh, yeah, I'm definitely not anti-vax.
Okay, so explain to me what's happening with the hospital. They said, get the vaccine or you're going to be fired. They didn't care if you'd had COVID before, right?
Yes, that was not anything you could even question. They wanted everybody vaccinated or get out.
Okay, and you got out, essentially, not by your own choice. You were fired, and you're now in this lawsuit. The hospital sent us a statement. Houston Methodist president and CEO to employees: you did the right thing. You protected our patients, your colleagues, your families, and our community. The science proves that vaccines are not only safe, but necessary. Your response?
I completely disagree with both of those, because we've already proved the vaccine is not working. A lot of people are still contracting COVID, and they're being hospitalized even after being vaccinated.
Right, but we can all agree on the numbers, though, that the vast majority of people who are hospitalized now are unvaccinated, and the vast minority of people who are hospitalized, especially in the ICU, are vaccinated. It does provide some protection. We can all agree on that, right?
It can provide some, but all the nurses I still talk to say a lot of their patients are fully vaccinated that are in the hospital with COVID. It's kind of like 50-50 in a lot of hospitals. But what he's saying about it being safe is not entirely true. There are too many people getting adverse reactions within just a couple of days, and no one's talking about it.
All right, so as we understand it, obviously you put quite literally your money where your mouth is, because you got fired from your job that I'm sure you enjoyed and were quite good at, to not take the vaccine. Is there any amount of arm twisting or restrictions that the government could place on unvaccinated people that would get you to take the vaccine?
Oh, absolutely not. That statement just blows my mind, because nobody should force you to take something if you're not comfortable taking it. And as nurses, we've already been properly trained on PPE, so we can wear the N95 and not spread anything to anybody. So with a huge nursing shortage, let us work. Don't fire us for absolutely no reason.
All right, Jennifer, we're going to follow your case. We appreciate you being here and explaining the perspective. It'll be interesting. Obviously, somebody from Houston Methodist is more than welcome to come on and chat with us, as well as the law